Hey, Dr. Chad here, Monday Fun Day again. Welcome to watching my favorite day of the week on Monday. So biggest question we're trying to get feedback from you and from a lot of our practice members is how does chiropractic help with this? Or I need to share this with someone else. Can you tell me how does chiropractic help with asthma? And so one of the most critical parts about asthma is that understanding that there's two areas of your body that can regulate or control how well you breathe. So one is going to be the cervical spine, the neck. And so the neck, there's nerves in the neck called the phrenic nerve that actually controls how well you breathe. That controls your diaphragm. So many people think about their diaphragm and how low it is. It actually is controlled by nerves in your neck. So with asthma, there's always a hyperreaction to some sort of stimulant or something going on within the nervous system that the body overreacts, and that makes them either breathe harder and it actually constricts their airway. So, well, why would the body do that? Well, there's several reasons. When you look at someone that has asthma, I've never seen anyone that's had asthma that also did not have significant damage structurally to their neck or to their mid-back. So when I talk about the mid-back, the most common thing that we see that will definitely increase your risk of having asthma is having a scoliosis. So when we have a scoliosis, we never want to see a deviation in the spine, left or right. And so one of the most common things that we see when people that have asthma is the first thing I'm going to look for is, do they have a scoliosis in their neck or in their mid-back? Because I've very rarely, if ever, seen anyone that's had asthma that didn't have a scoliosis. The other thing that could be going on, and, if you look at a nerve chart, the nerves in this mid-back area, you draw a straight line from your lungs to the back. And so all of these nerves, if there's misalignments of that scoliosis, that'll limit that communication from the spinal cord to that organ. And so that's one of the most common, like when people are thinking about, oh, well, what are some things that can make me more susceptible to XYZ condition? Well, the number one thing that makes you more susceptible to asthma is having a scoliosis in the mid-back. And this is why we see it more common in females. Females have a higher risk of, or they're way more common to have scoliosis than men. And so with the scoliosis there, that's one, and that could be from a trauma, but many times when you hit a big growth spurt, most of the time we find scoliosis in teenagers when they have either their last growth spurt or one of those things, and that significantly limits the capacity of their lungs to have full expansion and relaxing with normal breaths. But the most critical part, as with most everything in chiropractic, the most critical area is going to be this upper neck. So the atlas surrounds that critical part of your spinal cord called the brainstem, and there's literally nothing in your body that's not controlled, or in some part controlled by the brainstem. But there's a nerve that comes off the brainstem called the vagus nerve, and if there's significant shifting of the atlas left or right, or it can sometimes shift up like this, that can significantly pinch the vagus nerve. And if you ever wanted to do a lot of reading about a nerve, if there's one nerve in the body everyone should know about, it should be the vagus nerve. And so it sends a significant branch to the lungs, and that is one of the rest and digest, or it helps you relax and do your normal function. That's what regulates your breathing in your body. So if you have a significant trauma, or if you're one of those people that you look, somebody looks at you like, man, your head's always tilted like this. A lot of times, yeah, you can have neck pain or headaches, but that nerve significantly controls your lungs, but also your trachea. And so, like we talked about earlier with asthma, it usually very much narrows, or what we call stenosis. It makes that space where the airflow is going into the lungs significantly narrowed, and at that point, when that happens, your body has to do what? It has to work harder. Just like if you're trying to hike up a mountain or you're working out, you can't like get up the mountain by trying less hard. You have to work harder and you have to push to get a little further. It's exactly what your body does. Your body senses that you're lower in oxygen from whatever reason that is, whether it's your neck or your mid-back or some sort of stressor. Maybe you breathed in something that created that asthma response. I have several family members, extended family members that have asthma, and the smallest little thing sometimes can set it off. And it's very dangerous because if you don't have an inhaler, I mean, you could literally die if you didn't have that inhaler with you or someone giving you the inhaler. So with asthma, it's very similar to other conditions. So people always ask, well, do you think chiropractic can cure this, or can it? Chiropractic can't cure anything, but if we can work with the most important system in the body, which is your nervous system, if we can take as much stress and inflammation off of that, then your body will be able to have the best chance to adapt. There's not one inhaler in the world that's ever fixed someone's asthma. Yes, the inhaler takes away the life and death situation of asthma, but it's never corrected it. So when we talk about correcting, that takes a lot of work because there has to be structural damage in the spine to somehow mess with the nerves that has created that abnormal function that we call asthma. And so there's not a perfect one adjustment because every single person that has asthma could have a totally different presentation of where their misalignments are, which I know is difficult for a lot of people to understand. They think that, oh, if everyone has asthma, they should have the same misalignment in the spine. That's not true, just like none of us have the same traumas, none of us have the same fingerprints, none of us have the same life experience. So when we are looking at people, it is always a case-by-case basis. And there's been many people that we looked at their x-rays and we started adjusting them and it didn't help with asthma, and there's actually something else, an underlying condition, something else that we can't see with x-rays, that they had some other disease process going on that created their asthma. So for the most part though, most people that have asthma, especially kids, they get great results really quickly, because of that release of pressure on the nerve going to the lungs, but also if there's some sort of immune system issue, like a kid that always gets sick or an adult that always gets sick, the adjustments actually boost the immune system to where you don't have this overreaction. A lot of times with a lot of health conditions, with like the flu or pneumonia or this new virus that's going around, there's almost like this overreaction of the immune system. And if your nervous system is functioning properly, your immune system should function properly. And sometimes that'll limit the potential reaction of too much of an immune response that actually causes a lot of damage too. But that's again a severe neurological issue that can be going on from these structural misalignments in the spine. So with asthma, one of the biggest things, there's several different actual supplements as well that can help with asthma. We can maybe put a link here for that as well. But from a chiropractic standpoint, it's very important to understand that if you have asthma, someone that has asthma, they need to have their spine checked because more than likely they're going to have a scoliosis in their mid-back or in their neck, or they're going to have significant pinching of the vagus nerve, the brainstem in the neck. And if that's the case, there can be a significant change in how they can deal with their asthma, if not totally have it corrected. And so the sooner we find these problems, the easier it is to get corrected, because I'm 35, but if I had asthma at 15, it'd be way easier to fix asthma at 15 than it would be at 35, and way easier than, say, my parents' age, 60s and 70s. So hopefully this video will help. If you know anyone that has asthma, or if you've been helped with asthma through chiropractic care, comment, like, share this with people that you know. Our mission is to help as many people as possible with this specific chiropractic care that we offer. So we look forward to seeing you at your next appointments. We look forward to seeing you then. Thanks.